California Board of Registered Nursing NP Licensure Lecture. You only need to listen to this video if you are a California resident and or are planning to get licensed in the state of California. What is the Board of Registered Nursing? The Board of Registered Nursing is a state governmental agency established by law to protect the public by regulating the practice of registered nurses. The BRN is responsible for implementation and enforcement of the Nursing Practice Act, the laws relating to nursing education, licensure, practice, and discipline. The Nursing Practice Act created a 9-member board which serves as the Board of Registered Nursing decision-making body. The BRN is made up of 4 members of the public and 5 registered nurses. The registered nurses include 2 direct patient care nurses, an advanced practice nurse, a nurse administrator, and a nurse educator. 7 members are appointed by the governor and 2 public members are appointed by the legislature. Each member serves a 4-year term and can be reappointed but cannot serve more than 2 consecutive terms. So what happens after you graduate? What process do you need to follow after you graduate in order to get licensed in California? So once you graduate, you need to apply for a nurse practitioner license in California. Make sure that you get the correct application because they have different applications for different APRN roles. You will apply for a furnishing number in California, which is the privilege to prescribe medications. You will have to also apply for a DEA number. Once you find a job and you have a supervising physician, you will need to complete the standard procedures paperwork. You cannot begin working as a nurse practitioner without having a license and the standard procedures paperwork completed. You cannot prescribe medications without having a furnishing number, and you cannot prescribe scheduled drugs without a DEA. You will need to also apply for national certification. Certification/licensure as a nurse practitioner in California. California uses the term certification to mean licensure. You will also see that in some of their documents they use the term licensure as well. So just know that they use certification and licensure interchangeably. But this will be confusing for you guys because those of you who are in California, you will also have to sit for and complete national certification. So make sure that you have a clear delineation between what the California Board of Nursing is talking about as it relates to licensure and your national licensure exam, your national certification examination. Note that one cannot hold themselves out as a nurse practitioner in California without having a license. Doing so is illegal. Nurse practitioner is a protected title in the state of California. In order to practice in California, one must complete 2 separate applications. The first application is the application for nurse practitioner certification, also known as licensure. This officially provides you a license as a nurse practitioner. The fee at the time that this video was completed was $500, and at that link below the $500 you can always look up the updated fee. The second application that you will need to complete is the nurse practitioner furnishing number application. This provides you with the ability to prescribe medications and devices in California. Without this furnishing number, you may not be able to prescribe medications or prescribe or order DME. The fee for this application again is $400 at the time we completed this lecture, and you can get the updated fees from that website again. First, we will discuss the specifics of the application for a nurse practitioner certification /licensure in California. In order to be certified or licensed in California as a nurse practitioner, one must meet the minimum qualifications as follows. You have to have a valid and active registered nurse license in California, possess a master's degree in nursing, a master's degree in a clinical field related to nursing, or a graduate degree in nursing, and satisfactorily complete a nurse practitioner program approved by the Board of Registered Nursing. California provides 3 avenues by which one may be certified/licensed as a nurse practitioner in their state. Method 1, this is the process an applicant must follow if they graduated from a California-based nurse practitioner program. That is a nurse practitioner program that is physically located in California. Method 2, this is the method an applicant must follow if they graduated from a non-California based nurse practitioner program. As a graduate of the University of Texas at Arlington, you will have to be certified/licensed as a nurse practitioner in California using method 2. This method requires that you be nationally certified in your NP specialty by a certified body that is recognized by the Board of Registered Nursing. This method requires that you submit a copy of your official transcripts to the Board of Registered Nursing showing the completion of your graduation from your graduate degree or postgraduate NP program. This video will focus on method 2 because that is the method you have to use in order to get licensed in California. Method 3 is an equivalency method. I am not clear on when this method is used. This method requires verification of clinical experience from practicing NP or physician. As a graduate of UTA, you cannot use this method to become licensed in California. Method 2. This is a 4-page application that you will complete. To the left is page 1 of 4. You will complete this page and page 2 and send them directly to the Board of Nursing. The application is pretty self-explanatory, but I will explain the last part of this application titled Nurse Practitioner Education. You will need the following information: your school's name, which is the University of Texas at Arlington. We are located in Arlington, Texas. Our zip code is 76019. Your area of specialization will either be Family NP, Adult Geri Acute Care NP, Adult Geri Primary Care NP, Neonatal NP, Pediatric Primary Care NP, Pediatric Acute Care NP, or Family Psychiatric NP. You will put in whatever specialty that you are graduating from in this area. The completion date should be given to you by your lead faculty. If you are not given that completion date, then make sure you get the information from your lead faculty. You will have either graduated from a master's program or a postmaster's certificate program. You will need to check the appropriate box. Method 2 continued. To your left is the second page of the application you have to complete and send to the Board of Registered Nursing. The first part of this form you cannot complete because you do not have national certification yet. You will leave this portion blank. Complete the background information. Please note you are required to be honest on your application. Sign and date the form. Attach a 2x2 picture and send it to the Board of Registered Nursing. Page 1 and page 2 of this application can be completed online. You will need to create an account with the Board of Registered Nursing if you do not have one. We are continuing with discussing method 2. The next part of the application for method 2 is the verification of nurse practitioner academic program. Part A is to be completed by you. Make sure to sign and date this form. You will email the completed form to the Board of Nursing paperwork at uta.edu. Because this form asks you to list your social security number, only send this form to the above email address from your student email. This will protect your privacy. We will complete Part B and send the form directly to the California Board of Registered Nursing. This form will be sent to the Board of Registered Nursing on the first business day after the degree conferral/completion date. It will not be sent any earlier than this day because we cannot attest to the completion of your program until this time. Method 2 for licensure in California also requires you to complete, as part of the application, a verification of nurse practitioner certification by national organization or association. This is your national certification test that they are referring to. This is the last page of the application that you will have to complete. You will complete Part A and send it to the organization you will be taking your certification from. On the next slide, you will see the organizations to list on the application. The certifying body will complete Part B and return it to the Board of Registered Nursing after you have passed your certification. The California Board of Registered Nursing recognizes the following national nurse practitioner certifying bodies. The American Academy of Nurse Practitioners, or AANP. They offer a certification exam for family nurse practitioners and adult gerontology primary care nurse practitioners. American Nurses Association, their sub-organization called American Nurses Credentialing Center, offers certification exams for the family nurse practitioner, the adult gerontology acute care nurse practitioner, the adult gerontology primary care nurse practitioner, and family psychiatric nurse practitioner. Pediatric Nursing Certification Board, or PNCB, they offer pediatric acute care nurse practitioner certification exam and the Pediatric Primary Care Nurse Practitioner certification exam. The National Certification Corporation for Obstetrics, Gynecologic and Neonatal Nursing Specialties, also known as NCC, they offer a neonatal nurse practitioner exam and a women's health nurse practitioner exam. And then lastly, the American Association of Critical Care Nurses, or AACN, they offer an adult gerontology acute care nurse practitioner exam. You can verify this at the link on your screen. Certification and licensure process continued. Request your official transcript from UTA and have it sent directly to the California Board of Registered Nursing. Do not request the transcript until after your degree has been conferred. If you request it before the degree has been conferred, the transcript will not contain the correct information and you will have to request it again later. Degrees are usually conferred within 1 to 2 weeks of graduation. However, it can take up to 3 to 4 weeks to show up on your transcript. Please monitor your transcript in MyMav, and when you see the completion date listed on your unofficial transcript, then request your official transcript and have it sent directly to the California Board of Registered Nursing. The address is in the directions for the application at the link below. You will not be licensed by the Board of Registered Nursing until your application is complete. Please note that if you do not have a registered nurse license in California, you will need to apply for a registered nurse license at the same time you apply for the NP license. Make sure to read the instructions and application in its entirety. It is your professional responsibility to do so, and the links to the application are below. Furnishing number application and requirements. In order to prescribe medications, scheduled or non-scheduled medications, as a nurse practitioner, one must apply and receive a furnishing number from the California Board of Registered Nursing. This number provides you the privilege of prescribing medications and ordering durable medical equipment. Note that this application is separate than the application for the certification/licensure as a nurse practitioner. You cannot apply for a DEA number until you have a furnishing number. The DEA will verify your state license and that you have a furnishing number before issuing you a DEA number. This is a 2-page application. The first page you will complete and turn in to the Board of Registered Nursing along with the application fee. The second page you will complete the first part and then email the second part to the school. We will complete our part and return it to the California Board of Registered Nursing directly. The Board of Registered Nursing has many requirements for the pharmacology course, which this second page asks the school to attest to. We have worked to ensure that the pharmacology course meets the requirements outlined by the California Board of Registered Nursing. So let's look at the application specifically for furnishing number. The application is a 2 pages in length, and to your left is page 1 of 2. You will complete this page and send it directly to the Board of Registered Nursing with the application fee. Your NP specialty is either FNP, Adult Geri Acute Care, NP, Pediatric NP in Acute Care, Pediatric NP in Primary Care, Neonatal or Psychiatric Mental Health NP, or Adult Geri adult gerontology primary care nurse practitioner. The information you will need to complete this, you will need the name of your program, which is the University of Texas at Arlington. Your course name is Advanced Pharmacology for Nurse Practitioners. The course title is Nursing 5333. Number of quarters/semester units is 3 semester credit hours. The school address you will need and is listed there on your screen, and the completion date. Check your degree plan in MyMath for this completion date. Again, your lead faculty should announce the completion date as well. We are still talking about the furnishing number application requirements. The second page of the furnishing number application is called the Nurse Practitioner Advanced Pharmacology Course Verification. For this page, you will complete Part A. You will get the dates the course was taken from MyMath, so you will need to look up those dates. You will sign and date the form, and then you will email the completed form to the Board of Nursing Paperwork at uta.edu. Because this form asks you to list your social security number, only send this form to the above email address from your student email. This will protect your privacy. We will complete Part B and send the form directly to the California Board of Registered Nursing. This form will be sent to the Board of Registered Nursing on the first business day after the degree conferral completion date. It will not be sent any earlier than this day because we cannot attest to the completion of your program until that time. Again, please note that you cannot apply or receive a DEA without a furnishing number. After you have obtained a furnishing number, you can apply for a DEA. Remember, you cannot prescribe in California without a furnishing number. Make sure to read the instructions and applications in their entirety. It is your professional responsibility to do this. California Board of Registered Nursing application processing time frame. It can take anywhere from 10 to 12 weeks for the Board of Registered Nursing to process your application. For an APRN application, it may even take up to 12 to 14 weeks. You can see the current processing time frames on the following website listed on your screen. Certification/licensure renewal in California as a nurse practitioner. The nurse practitioner certificate/licensure and furnishing number is renewed every 2 years with your RN license. Again, let me qualify. This is not talking about your national certification that you receive from the national certifying body. Your first renewal period may be less than 2 years. Make sure to renew your RN license, the NP certificate, and furnishing number. The renewal fees are required and vary. They can be viewed at the following link on your screen. Make sure to renew timely because the fees are more expensive if you are late to renew your license. The Business and Professional Code Section 121 provides that a nurse may work pending license renewal, providing the renewal fee has been submitted timely and all renewal requirements have been met. But note that the employer may have more stringent requirements. You can verify all this information by at the link on the bottom of your screen there. Certification/licensure as a nurse practitioner renewal requirements. All RNs are required to complete 30 contact hours of continuing education in order to renew their license. They must be completed during the preceding renewal period. Courses must be taken by a provider who is recognized by the Board of Registered Nursing. Courses must be relevant to the practice of nursing and must enhance the knowledge of the registered nurse above the level required for licensure. It is prudent and a professional responsibility that you complete these courses in your area of specialty to show ongoing competence. The Board of Registered Nursing does not specifically say this, but again, it is your professional responsibility to do this. I believe you might be questioned if you completed all of your hours in something that did not apply to your specialty. Courses must be related to the scientific knowledge and/or technical skills required for the practice of nursing or be related to direct or indirect patient-client care. Courses related to the scientific knowledge for the practice of nursing include basic and advanced courses in physical, social, and behavioral sciences, as well as advanced nursing in general or specialty areas. Content, which includes the application of scientific knowledge to patient care, in addition to advanced nursing courses, may include courses in related areas: human sexuality, death, dying, and grief, foreign languages, therapeutic interprofessional skills, pharmacology, and those related to specialty areas of nursing practice. Courses in nursing administration, management, education, research, or other functional areas of nursing related to indirect patient/client care would be acceptable. More specifics can be found at the link below on the screen. Additional contact hours are not required for APRNs above the 30 contact hours needed for your licensure renewal. Please note that your national certifying body will require more continuing education hours than the Board of Registered Nursing. You must meet both requirements. BLS and CPR courses cannot be used to meet the requirement. To see a list of other courses that do not meet the requirements set by the California Board of Nursing, look at the link below. Please note, in order to maintain your national certification, your national certifying body will require that you complete a number of continuing education credits. The continuing education you complete for national certification will need to apply to your role as a nurse practitioner in your specialty population. Additionally, they will require you to have certain types of continuing education hours, such as 25 hours in pharmacology, provided that these courses you take are approved by an organization that the California Board of Registered Nurses recognizes, then they will also meet your BRN requirements for renewal. Check with your individual certifying body to make sure that you know what their requirements are for renewal of your national certification. Make sure you keep the documentation of all your continuing education courses. The Board of Registered Nursing or the certifying body can request them at any time. You will need to submit them to the certifying body when you renew your certification as well. That is the end of this video. Thank you.